Okay, on this slide we are going to get into depth, or talk in depth, about the related services for here in South Dakota that you and your child can receive. Related services means transportation and developmental, corrective, and other supportive services that assist your child with a disability to prevent or to benefit them and their educational advancement. So these include speech-language pathology, audiology services, interpreting services, psychological, physical and occupational therapy, counseling services, and even transportation to and from job sites, for example. Basically, the only exception is services that apply to the children with surgically implanted devices, and it's going to be things such as if your child is deaf and they get a cochlear implant, for example, that is not included in related services. So let's get into depth a little bit more about them. So we'll start with assistive technology services. This is any service that directly assists your child in the use of technological devices. So, for example, in school, if your child has trouble seeing things, we can have them wear the audio headphones and they can listen to the lesson. If your child has trouble typing, there's alternative keyboards and alternative mouses that they can use in order to help them use the computer, or there's screens that allow the text to become bigger and things of that sort that all are just designed and customed to fit your child as well as their IEP goals. Then audiological services, and this is for children with hearing loss. So it includes things as, speech, reading, so it helps them learn how to read lips, hearing evaluations, speech conservation, training for you to help your child learn how to lip read and that sort of thing. It's basically any kind of service that is extra that will help your student learn how to communicate with others if they have trouble hearing. Then there's also interpreting services. This is for those children who may not speak English. So there's a few different services. There's cued language transliteration service, sign language, interpreting skills, transcription services. So that would be things that help them communicate, maybe a communication device, that type of thing. There's also medical services, occupational therapy. That would be from a qualified occupational therapist included in that, and a lot of different students will receive this even in their special ed classroom. Occupational therapists will often come and see them and then bring in tips and stuff for the special education teacher to implement into class. There's mobility services. This is for students who are blind or visually impaired, and it helps them learn how to transfer themselves around, cross streets, and do things in the community that they could then do to help them live independently and transfer themselves around. Then for you parents, there's parents counseling and training. So that's basically just helping you understand the needs of your child and support, after you find out maybe of your child's disability or hear progress or, that your child may or may not make. It's oftentimes good to get counseling to help you through that. A lot of students in the special ed get physical therapy, and again, the physical therapist will often come to the classroom and do different exercises with them and give, again, your child's special education teacher techniques and tips to use in class. There's psychological services, recreation, so that's fun things for the students to do to get out and have some leisure fun and get some education in there as well. Rehabilitation counseling services are also in there. School health services and the nurse services. Those are nurses usually at every school. And the nurse will help your student if you have a child with diabetes, to help them monitor their lunch, maybe learn better eating habits, all of those types of things, and those are going to be included on the IEP. There's social work, speech language pathology. That's one of the most popular probably that I've encountered. A lot of kids go to speech from special ed to help them, pronounce vowels, that type of thing, and often will spend a lot of time in the speech room throughout the week. Transportation, again, we talked about this. It will help your student get, to and from school. They might provide a bus to get your student to school. They will provide transportation to a CBI where the students can go out and experience shopping and learn how to do things within the community. That's all included in the special ed room. So those are just a few of the related services that are included here in South Dakota for your students. Okay, Now we're going to move on to the South Dakota parental rights and procedural safeguards, and I added a couple of links here on the PowerPoint that are great, that list a lot of the information that you would need for your parental rights here in South Dakota. It's great resources. As we discussed previously, there's a few, basically everything in the special education is going to require your consent, all the way from testing to placement. So basically a copy of the procedural safeguards here in South Dakota must be given to you as the parent of the child with a disability at least once per school year. Okay, a copy must also be given to you when you get an initial referral or request for evaluation for your child. Or if you request evaluation of your child, you must also be given a copy of the safeguards. Also, when your child may be disciplined in a manner that changes your child's placement. And lastly, after the first filing by you of a state compliant or due process hearing complaint in a school year. Okay, so you are given these procedural safeguards quite frequently. Then they move on to discuss the parental consent and what a parent means here in South Dakota. It's a biological or adoptive parent, a foster parent unless restricted by state law, and a guardian appointed by the court, an individual acting as a parent in the absence of a biological or adoptive parent. So these can be grandparents, step-parents, etc. A surrogate, or a specific person that the court has ordered as a parent. So those are the people who can be considered a parent here in South Dakota to make these decisions for your child. So consent for services. In order for your school to make any kind of evaluations or anything on your child, they need your consent. So the school district needs to make reasonable efforts to get that consent from you before providing any special education services or related services to your child for the first time. So if they're trying to do this for the time, they need your consent, and they need to make a lot of effort to get that from you. If you do not respond to that consent for your child to get those services, or you refuse to give consent, and you later cancel your consent writing, your school district would not use the IDEA dispute resolution procedures, okay, in order to override your lack of consent. So, also, if you refuse to give consent, fail to respond to a request for your consent for your child to receive these services, or you later cancel again, and the school district stops providing special education services, it is not a violation of that. It's not a violation of the requirement to make that free, appropriate public education. Because basically you kind of cancel and everything of that sort. Then there's consent for reevaluations. Again, they need to reach out to you for all of these things. And make sure that it's okay with you. Again, your school district needs to get consent before they reevaluate your child, unless they took reasonable steps to get your consent and you did not respond. Then we move on to prior written notice, at least 5 days before recommending or refusing to begin a change of the identification, evaluation, or placement of your child from that free appropriate public education that we keep talking about. The school district must provide you with that prior written notice. And it must be explaining what they're going to be doing and what they're wanting. Okay, so then you have the right to have an IEE, which is an independent educational evaluation of your child at the public expense. An IEE means an evaluation conducted by a qualified examiner who is not employed at the school district. So they need to pay for that if you request that. If you obtain an IEE at a public expense or share with the school district an evaluation obtained at private expense, the IEP team member must consider that IEE or other evaluation shared by you. Okay, then you have the right to confidentiality. A lot of that personal information is supposed to be private, and you have the right to that. You have the right to keep your students' privacy. But yes, this PowerPoint on here, on the link, basically goes through exactly all of the steps that are taken from all the parent requests for all the different stages of the process, all the referrals, all of the prior written notices, all of those things are discussed here in that. And basically, like we had discussed in previous videos, your consent is needed for initial testing, placement. You need to be on the IEP. They need to make effort to get you to that meeting. And and that because your consent and your information matters for your student's placement. So again, if you have further information or wanting further information on your rights, then review that PowerPoint that is attached.